Welcome back to Joy News Prime. The overlord of the Mamprugu traditional area, Dura na Seidu Abudu, is warning family of a deceased COVID-19 patient in Wale Wale against refusing to cooperate with health authorities after they were identified as having been exposed to the victim. The 19-year-old who died at the Wale Wale Municipal Hospital a week ago was only diagnosed after the body had been released to the family for burial. Health authorities have therefore advised the family to self-quarantine so they could be tested at a later date. The family is however unwilling and the chief is unhappy.
The family that they should be careful of their movement and how to arrange themselves within the family so that no one will contact the disease. And the family said, okay, they have already organized themselves. That was yesterday. I sent a message to them and they told me that they have organized themselves in the sense that they will not touch the disease, the cause. And moreover, the point, the belongings of the cause will not touch it. And the family have to be careful with themselves for the disease not to get them.
Spokesperson for the family, Alassane Ibrahim, however, says the family has since backed down and that 7 members who had direct contact with the deceased and earlier refused to cooperate with the health personnel have agreed to self-quarantine. All units of the Wale Wale Municipal Hospital, meanwhile, including the emergency and OPD, have been closed for disinfection following the death. The Volta Regional Deputy Director of the Ghana Health Services in charge of public health, Dr. Senanu Jokoto, says his outfit has begun contact tracing following 9 cases recorded in the region. He said relatives and individuals identified to have been in contact with infected persons would be under mandatory quarantine with supervision from health officials. He was speaking with Joy News' Volta Region correspondent Fred Kwame Asare in Ho.
When it comes to contact tracing, anytime you suspect a case, it is positive until proven otherwise. So all the infection prevention and control measures are in place. And then from the onset, you begin to list all the people who have been in close contact with some of these cases. That's what we call contact listing. And then immediately the case is confirmed as positive, you begin to follow up on these people and find out if there are any other contacts that you could have missed. So that is currently underway in the Volta region now, in Ketu South, in Popoi, and in Ho. The health workers are going to check up on them in the morning and in the evening with the appropriate protective gear. They check their temperature. And then anytime they have symptoms, they would report to us. One key component is to ensure that all of them are psychologically stable. So what we do is also to send some psychologists to talk to them, to encourage them, to let them know that this is a particular condition we are dealing with, and then with time it's all going to be over.
Dr. Jokoto also explained 3 of the 9 cases were discovered through routine surveillance at health facilities, while the remaining 6 were foreign nationals who had entered the country through illegal routes and are under mandatory quarantine at Aflao.
We have 2 main categories of cases that we are looking at. Those who were under mandatory quarantine in the Volta region. Some people tried to breach our borders when it was closed. They were apprehended and the samples were sent into mandatory quarantine. After 14 days, we took their samples. So far, we have taken 56 of those samples, and 6 of them have proved positive. The other 50 were negative. We have 50 more in isolation, and we've taken their samples, but those ones are pending. Now, from the routine surveillance, that's the people we see in our hospitals who present like it could be COVID-19. We have a case criteria, which we call the case definition. If they fit in, then we take their samples and send it to Noguchi. So far, we have taken 49 of those samples.